COVID-19 death numbers in Oregon could see a sudden rise in the next few days. Why? Well, health officials are now considering adding presumed cases to the state's death toll. That's what they've done in some other states. Wayne Haverly joins us live from home with the latest on the changing methodology of counting COVID-19 deaths. Wayne?
Yeah, most of those presumed cases that we're talking about are patients who died outside of the hospital and they were never tested. Now, some states, even the federal government, are now counting these presumed cases, and Oregon could be next.
Not all victims of the coronavirus die in hospitals. Many pass away at home, others in long-term care facilities, and some have never been officially counted in death totals because they were never tested for COVID-19. A good example of this was revealed during a news conference last Thursday about a rash of deaths at Portland's healthcare at Foster Creek. 14 deaths were attributed to COVID-19, 13 confirmed, and 1 presumed.
The question is if the numbers reported by OHA is all COVID positive or includes presumed COVID positive. We'll get the answer to that question to you. We don't have that information in the room right now.
Senior Oregon health officials now say they are discussing the possibility of adding presumed cases to the overall COVID-19 death totals. Today, an Oregon health official told KOIN 6 a decision hasn't been made on the timing of the release of those additional presumed cases, but that more info could be coming in the next few days.
We're not out of the woods. We have to go forward.
Last Tuesday, New York added presumed cases to the death totals, which inflated the death count by thousands, increasing the nation's overall death count by 17%. Some critics argue adding these presumed cases is misleading and padding the overall death count. The change in methodology came after a strong recommendation to state health departments from the Council of State and Territorial Epidemiologists. They said counting presumed cases provides a more accurate overall picture, and just like New York, the CDC listened to our nation's top medical scientists and is now also counting presumed or probable cases.
Now, according to the CDC, here's what the presumed cases are. A presumed or probable death, depends what state you're in, they call them both the same thing. It's one that meets clinical criteria such as symptoms and evidence of the disease. Now, Oregon is expected to make this decision whether or not to add these presumed cases in the next couple of days. Back to you.